Hello, my geniuses. Welcome to another physiology playlist. Today it's your great science tutor Lorenzo, and we'll be talking about the cardiac output. So this cardiac output is part of the physiology, the cardiovascular physiology playlist, where we talk about the introduction to cardiovascular system. We talked about the cardiac cycle, talked about the heart sounds. So we talked about a lot of topics. Then now we're in the cardiac output. So we'll be doing, like I said, the series is a succession. So when you are reading, you start from the beginning, so that when you reach here, it will be better for you to understand. You understand very well. And if you have a question, just drop it down in the comment section. And if you are new, make sure to subscribe and turn on your post notification button, so that anytime I drop any video, you will be sure to be notified. So if you now want me to make any topic, or you are confused, or you want me to clarify anything, drop it down in the comment section and tag me, and when I'm going to it, I'll make that video solely for you. So let us jump right into the video. So starting from now, we'll be talking about the introduction to the cardiac output. So cardiac, which means heart, out, which means giving out. Cardiac means heart, output, which means giving out. So what is cardiac output? So the cardiac output is the amount of blood in which the ventricle is releasing per minute. So that is the amount of blood in which the ventricle is being pumping per minute. So that's what the cardiac output is. So remember, we have 4 chambers of the heart. We have the right atrium, left atrium, we have the right ventricle, we have the left ventricle. So the amount the ventricles are pumping per minute is called the cardiac output. So remember, the right ventricle pumps it through the pulmonary trunk to the lungs, while the left ventricle pumps it through the aorta to the rest of the body. So the amount they pump every minute is called the cardiac output. Are you getting me now? So before they call it naturally, they call it left ventricular output. Are you getting me now? It can be called left ventricular output because it's always dependent on the amount of blood the left ventricle is pumping per minute. That's what gives the cardiac output its true meaning, because we are not taking in consideration the right ventricle pumping to the lungs is also important, but here, due to systemic circulation, is the amount of blood the left ventricle pump to the aorta per minute. So you can also call it left ventricular output. So the importance here about the cardiac output is that it is most important factors in the cardiovascular system, because the rate at which blood flows to different parts of the body is dependent on the cardiac output. So if the cardiac output drops, which means blood will not be pumped from the left ventricle to the rest of the body through systemic circulation. So if you go to my introductory playlist, I talked about the pulmonary circulation and the systemic circulation. Pulmonary circulation is the blood going from the right ventricle to the lungs for oxygenation. Then the one that goes from the left ventricle goes to the rest of the body. So it has to go to the ascending aorta, goes to the arc of the aorta, and go to the descending aorta. To the ascending aorta, the coronary arteries take blood to the heart. To the arc of the aorta, the head through the carotid vessels take blood. The subclavian vessels to the upper limb also take blood. Are you getting me now? While to the descending aorta, the thoracic cavity takes blood, which is the structures in the thorax take blood, and to the abdominal aorta, the abdominal organs take blood, and to the iliac vessels, the lower limb and pelvic organ also takes blood. So if the cardiac output is low, which means all other organs are suffering, are you getting me now? So they can go into shock. So when the cardiac output is low due to low amount of blood reaching other organs or other structures in the body, that will lead a patient into shock. Are you getting me now? So that is very, very important. So cardiac output is a very key vital point and component of the cardiovascular system. Are you getting me now? So if we are looking at the definition and normal values of some component in cardiac output, we'll be talking about the stroke volume. So remember, the amount of blood pumped through the left ventricle specifically, or through the both ventricles per minute, is called the cardiac output. Are you getting me now? And we can call it the left ventricular cardiac output, and it is a very, very important component and status in the cardiovascular system. So now, one thing you have to look out for here, very, very important. We are talking about, first of all, we're talking about the stroke volume. Are you getting that? The stroke volume. So if you remember stroke volume is a part of cardiac output, which I'll give you the formula later. Yeah. So the stroke volume is the amount of blood pumped by the ventricle in one heartbeat, so not 1 minute. Cardiac output is the amount of blood pumped from the ventricle per minute, while stroke volume is the amount of blood pumped from the ventricle per heartbeat. So when you hear one heartbeat like lop or dop, remember the first heart sound, second heart sound. First heart sound is the closure of the AV valve, second heart sound closure of the semilunar valve. So when you are hearing one heartbeat, a stroke volume has been originated. And what is stroke volume? So stroke volume is the difference between the end diastolic volume minus the end systolic volume. So if you go to my cardiac cycle playlist, you see it there when I taught the cardiac cycle. So the end diastolic volume is the amount of blood that enters into the ventricle during ventricular filling, during ventricular diastole, while the end systolic volume is the amount of blood that remains after ejection fraction have occurred or the ejection phases have occurred. So now the amount of blood that is pumped from the ventricle per heartbeat is called the stroke volume, and it is about 60 to 80 ml, which is averagely 70 ml. You get it now? Don't forget, keep this in your brain as I'm explaining it. Is very, very easy. So the amount of blood pumped per heartbeat is called this stroke volume. So what is the minute volume? So the minute volume is the amount of blood pumped in 1 minute. So the amount of blood that goes out from the ventricle in 1 minute. So that's what it calls minute volume. So this will tell you that the minute volume is equal to the cardiac output. So the same thing. So sorry if I'm talking about cycle instead of output. It's just that cycle enters my mouth when I talked about output. So anytime I say cycle, so sorry, just know it's output. So now the minute volume is equal to the cardiac output, because they measure the amount of the blood flowing from the ventricle in 1 minute. So you get it now. So always remember, and it is about 5 liters per minute. So you have about 5 liters per minute. And you should remember the cardiac output equals to your stroke volume times your heart rate. Your stroke volume times your heart rate. So the amount of cardiac output you give every minute is 5 liters. So your body takes in 5 liters from the SVC IVC into the right atrium, and from here go to the lung. So 5 liters is supplied back to the heart, while 5 liters leave the heart to be supplied. So you cannot have shortage of it. If you have such a shortage of it, which means you turn the blood into hypovolemia, because when the blood volume reduces, you have hypovolemia, and when you have hypovolemia, you can go into hypovolemic shock. This is when your cardiac output is not meeting the body's demand. Are you getting now? So naturally, every minute you have 5 liters that the body is sharing every minute. So you have cardiac output is equal to stroke volume times heart rate. So I will say stroke volume is the amount of blood pumped out from the ventricle per beat, and 1 beat takes 1 cycle. 1 beat takes 1 cycle. Are you getting me now? So you have this a closure of the AV valve, the first heartbeat, closure of the semilunar valve, second heartbeat. So you just see it like that. So 5 liters per minute for the minute volume, which is say the same thing as the cardiac output, while the stroke volume is about 60 to 80 ml, which is 70 ml at average. Now what is cardiac index? So don't forget about cardiac index. So cardiac index is an expression of the cardiac output per the total body area, surface area. So when you're having your cardiac index, you are calculating the amount of blood that is supplied per the person's body surface area. So a wider surface area, a wider surface area, we have a less cardiac index. Are you getting me now? A wider body surface area, we have a less cardiac index. So when you increase the cardiac output, so the higher the surface area, the higher the cardiac output. But the higher the cardiac index, the lower body surface area. So somebody with just like an obese person, somebody that is obese, it will automatically have a low cardiac index. Are you getting me now? Because cardiac index is inversely proportional to the body surface area, but directly proportional to cardiac output. So when I am increasing the cardiac output, which means I can increase so when I'm increasing the total body surface area, I can also increase the cardiac output. So somebody that is big need more oxygen, need more blood, which means the higher the body size or the higher the body surface area, the higher the cardiac output. But the higher the body surface area, the lower the cardiac index. And the normal value here is 2.8 plus 1 plus or minus 0.3 liters per minute per meter square. So don't forget it. So it can be a variable number in the text you are using, or if you're a student and your lecturer gave you a slide to read, it could be varying. So the cardiac output per unit body surface area is called the cardiac index, and the cardiac index is inversely proportional to the surface area. I get it, but directly proportional to the cardiac output. So increase the cardiac output increases the cardiac index, but increases the cardiac index reduces the total body surface area. So one thing you have to recap: the stroke volume is 70 ml, which is 60 to 80 ml per watt range. Then while the cardiac output here is 5 ml per minute, and the cardiac index is 2.8 plus or minus 0.3 liters per minute per meter square. Are you getting now? And you always remember, cardiac output is equal to stroke volume times your heart rate. Are you getting now? Times your heart rate. So now your heartbeat is, remember, your heartbeat comes when you complete a cardiac cycle, either the closure of the AV valve or the semilunar valve. So are you getting now? So when you pump blood, the difference between the end diastolic volume and systolic volume, you get your stroke volume, and your cardiac output is equal to your stroke volume times your heart rate. Are you getting me now? So we have said all these things. So the next one, what is the distribution of the cardiac output? So how is the cardiac output distributed to every part of the body? It's very, very important. We have to know how much each organ takes blood, how much each organ needs a blood or takes blood from the heart. Okay, now, so when the heart takes in blood from the right atrium to the right ventricle, from the right ventricle to the pulmonary trunk, to the lungs, through the pulmonary artery. So when the lungs oxygenate the blood, it comes through the pulmonary vein down to the left atrium. So now we want to know how many percent each of the organs are taking blood. Very, very important, because you need it for your exams. So the distribution of the cardiac output is that the right ventricle takes blood to the lungs for oxygenation. Pulmonary bring blood to the left atrium. From the left atrium to the left ventricle. From the left ventricle, they pump it to the aorta. And I told you that in the ascending aorta, who takes blood? The coronary arteries take blood to the heart. Again, when blood is being pumped out to the ascending aorta, because we have three types of aorta. We have the ascending aorta, we have the arc of the aorta, and we have the descending aorta. The ascending aorta leaves the left ventricle. When it leaves the left ventricle, at the ascending aorta, you have the coronary sinus. So that coronary, that's where blood leaves to go into the heart, to the coronary arteries. From the coronary arteries is supplied to the heart muscles. So very, very important. So the heart takes blood to the ascending aorta. So they are opening of what we call anterior and posterior coronary sinus. So this sinus is where blood leaves into the coronary arteries to the heart. So the heart takes their own blood to the ascending aorta. So they have an opening there. During protodiastolic period, blood flows into that area. Then I told you that when it gets to the arc of the aorta, the carotid vessels are there to take blood to the head and the neck, to supply the brain, to supply other structures in the head and neck. So also the subclavian vessel is in the arc of the aorta, which takes blood to the upper limbs. You get it now? Then why, when the blood now start going to the descending aorta, what happens? The thorax, the structure in the thorax takes blood, which is the lungs. Apart from even the lungs, the lungs takes blood, the bronchi system takes blood, the thymus takes blood, other structures, the esophagus takes blood, the every part, the diaphragm too takes blood to the descending aorta. So when it goes to the abdominal aorta too, so many structures down to the iliac vessels that supply the lower limb. So now the cardiac output is important to supply blood to the rest of the tissues. Are you getting that? So when the cardiac output reduces, there's a problem. So we want to check out the percentage of who and who needs and how many blood they need, like what are the amount of blood they need in everywhere. So the liver has the highest cardiac output, very, very important, of 30%, which means the liver, out of all the cardiac output, out of the 5,000 ml, which is 5 liters, the liver takes about 1,500 ml. Are you getting now? Very, very important, which is 30% of the cardiac output. So for your exam, the liver takes the highest percentage of cardiac output in every part of the body, which is very, very wow, because the liver does so many things. It does detoxification, it does metabolism, it does a lot of things. So it deserves to take the highest amount of the cardiac output. So the kidney is next. The kidney takes about 1,300 ml. which is about at least 25-26% of the cardiac output. Again, so the kidney is where reabsorption occurs. Are you getting that? The kidney helps us to remove waste product from the body, liquid waste product from the body. So when they have been detoxified by the liver, what happens? They flow through the kidney for us to remove it. And any lost substances that is running away from the body, the kidney catches it and take it back into the blood. And anyone we don't need, the kidneys remove them away. So the kidney is the next person that takes the highest amount of the cardiac output, followed by who? Skeletal muscles. Very, very important, because without the skeletal muscles, we will not be able to locomote or to move around, because the skeletal muscles are important to move, because without movement, you have venous stasis. Blood will pull down to your leg, you'll be immobilized. From there you form clots, thrombosis. From there, dislodge, go to your brain. So we need to move around. Without movement, there'll be issues, there'll be edema, there'll be so many inflammatory reactions that comes when you are immobilized. So the skeletal muscle needs a lot of what? Blood. Are you getting that? So how many is it taking? It's taking 900. You see, 900 at about 18%. So wow. So the skeletal muscle even takes more than the brain, because the brain takes only 800 ml per minute. Are you getting now? Which is about 16% of the cardiac output. So the brain is also important, because the brain consumes a lot of glucose, because it does a lot of things. Yeah, your thinking process, when you want to evaluate everything you do, the brain, the neurons takes this oxygen and nutrient in order to carry out all those neuronal activities that we need. So the brain takes about 800 ml per minute and 16% of the cardiac output. So our skin, bone and GIT tract take 300, which is at 6% cardiac output, and the heart itself through the coronary vessel takes the least, which is about 200, for about 4% of the cardiac output. So the heart itself needs blood, because if it doesn't have blood, especially in coronary artery disease, there will be myocardial ischemia. From myocardial ischemia, myocardial necrosis, and from there, what happens? The heart will be have what? Myocardial infarction, which is heart. So there will be myocardial infarction, which is what? Heart attack. So when there's heart attack, it's two things involved. If the heart doesn't respond to another action potential, what happens? The patient will die. And remember, even the heart is usually mostly one of the last things that die late. Even though a patient is brain dead, if the heart is still beating, the person is still there. It's just that there's no responsivity with the person again. But when the heart offs, when the heart goes, what happens? There's no more pumping of blood, there's no oxygen again, the patient is gone. Are you getting it? So the heart takes the least cardiac output from what I've given you, which is about 4% cardiac output at about 200 ml per minute through the coronary vessels. Are you getting now? So very, very, very important for you to know. And I gave you this percentage so that you will get it for your exam. The highest person is the liver, followed by the kidneys, followed by the skeletal muscles, followed by the brain. The heart takes the least of the cardiac output. So I'm explaining it little by little. So I'm explaining to the best. I'm repeating myself. So you are just have to, when you are reading, when you are listening to me, you are writing down, you are understanding what I'm saying. Because when I introduced the cardiac output, I said the cardiac output is the amount of blood pumped by the ventricle per 1 minute, which is equal to the minute volume. Are you getting me? So the minute volume is also the amount of blood pumped by 1 minute, which is the cardiac output is equal to your stroke volume times your heart rate. So when you increase your heart rate and you increase your stroke volume, you increase your cardiac output. And I talked there about cardiac index, which is cardiac output per unit body surface area. Again, so we talked about all of them, very, very important, which we need. And now we talked about the distribution of the cardiac output to every part of the body. So another important part here for exams they will ask is about the factors that are affecting cardiac output. What increases or decreases cardiac output? What makes it important for cardiac output to what occurs? Because all these things you need it in your diagnosis. So if you know this preclinical part of physiology, it makes it easier for you to pass so many exams and for you to participate in diagnostic treatment. Very, very important, because this is the baseline of what you need when in your clinical class. So now the first one we'll be talking about is the venous return. Are you getting that? So venous return, we want to know what is the effect of venous return on the cardiac output. So is venous return directly proportional or inversely proportional to the cardiac output? So that's what we want to know. Are you getting now? So what is venous return? The venous return is the amount of blood that goes back to the heart from the venous system. So the amount of blood that goes back to the heart to the venous system is called what? Venous return. Are you getting that? So remember, oxygenated arterial blood moves to the arteries, from the arteries to the capillaries, from the capillaries to the veins, from the veins back to the heart. So the arteries take blood from the heart. Are you getting that? The vein takes blood back to the heart. So for you to have cardiac output, remember I say 5 liters per minute must be taken away from the heart to be supplied to the body, and 5 liters must go back to the heart so that it will rebalance. Are you getting me now? So if the 5 liters is not going back and the venous return is low, which means where is blood staying, which means blood will be staying, either blood is being lost or blood is staying in the tissues. You get it now? Are you understanding? Either you have lost some volume of blood to anything. It could be burn, it could be accident, it could be anything. Either you have lost them or they are in your tissues. That will what will reduce your venous return. Are you getting me now? Because if venous return is high, which means as 5 liters is going back to the heart or more is going back to the heart, the body is also taking away 5 liters. So which means cardiac output is directly proportional to the venous return. Which means when you increase venous return, which is blood going back to the heart to be reused again, you increase cardiac output. So anytime you reduce venous return, what happens? You are reducing the cardiac output. So let me say, for instance, maybe 3 liters is coming back into the heart. So if the heart takes 3 liters, it cannot give you 5 liters because it depends on the one you give it before it gives you the same amount that you give it. So bringing into the heart 3 liters, the heart will also give you 3 liters. So reducing the venous return reduces the cardiac output. Again now, because blood goes back into the right atrium to the SVC from the head. So the superior vena cava brings blood from the head, while the inferior vena cava and the azygos vein bring blood from the lower part of the body, and all of them uses a high venous pressure to bring blood back into the right atrium, from the right atrium to the right ventricle, from the right ventricle to the lungs for oxygenation. So remember, at an increased venous return, you will consequently increase your cardiac output. So cardiac output is directly proportional to heart rate. And what is venous return? Venous return is the amount of blood that is brought back to the heart to the venous system. And if we want to talk about the venous return, what is the effect here? What affects venous return? What will affect venous return, either positively or negatively? We have the respiratory pump, we have the muscle pump, we have gravity, we have venous pressure, and we have sympathetic tone. So these are components that help strengthen your venous return. I'll talk about them. So the understanding is what I need you to get. It's not just to read and write. You need it for diagnosis, you need it for treatment, not just to pass your exams, because you are not going to be a doctor with only passing your exams. You are going to be a good medical professional when you know what you are doing very well. You can make case diagnosis from the scratch, things that you might not know before you might know it well. So now the first one is the respiratory pump. So how does respiration increases cardiac output? So how do you respiring increase cardiac output? So remember, when you take a deep breath, maybe when you inspire, what happens? In inspiration, by taking a deep breath, first of all, there's a negative interpleural pressure. First of all, there's a negative interpleural pressure because the pleural fluid cannot be drained into the venous circulation. Are you getting me now? So now there's negative interpleural pressure, there's a decrease in interthoracic pressure. So there's a negative interpleural pressure, there's a decrease in interthoracic pressure, but an increase in interthoracic volume. So it is not going the same way. Pressure is inversely proportional to volume. So when you take a deep breath, immediately there will be more space in your thoracic cavity for your lungs to expand, and if there's more space in your thoracic cavity for your lung to expand, your lung volume will increase, which means there will be space for your lung to take air. If your lung is taking air, there will be increase in interthoracic volume, but the pressure will decrease because there are more spaces in the thoracic cavity. So which means the interthoracic pressure will decrease, but the interthoracic volume will increase. Now if the space in the thoracic cavity is increasing, which means the diaphragm will descend to create more space in the thoracic cavity. So but as the diaphragm is descending, which means it is compressing the abdomen. Are you getting me now? So creating what we call a positive intra-abdominal pressure. So if take a deep breath, you are inspiring, you are taking air into your lungs, your diaphragm will descend in order to create space for the thoracic cavity to expand, compressing the abdomen, causing an increase in what intra-abdominal what pressure. So when there's increase in intra-abdominal pressure, what happens? It constricts the IVC, increasing venous return. So hope you understand it. Taking a deep breath, negative interpleural pressure, because your pleural fluid cannot drain into your lymphatic system or your venous system. So there will be negative interpleural pressure, because when you take a deep breath, there's closure of the drainage system of the pleural fluid. So there will be negative interpleural pressure. There will be increase in interthoracic volume, but decrease in interthoracic pressure, because of the thoracic cavity has increased to allow the lungs to expand. So in doing this, the diaphragm will descend, compressing the abdominal component. So when you compress the abdominal component, there will be increase in intra-abdominal pressure, causing the constriction of the IVC to increase venous return. So that's how your inspiration can cause an increase in venous return. So the next one is muscle pump. So how does muscle pump work to increase venous return? So very, very simple. That's why you have to be mobile. So mobility helps increase venous return. So for those that are sick, that are usually bed bound, what happens? All their blood, all their component of their blood will go to the extremities, and there will be venous pulling, which I'll be talking about. So when you are not moving, movement helps you to constrict the muscle. So if you are constricting the muscle, especially in the lower limb, constricting the muscle pushes all the blood from the superficial veins to the deep veins, from the deep vein back to your heart. Are you getting now? So the muscle pump, it acts as a peripheral contractile system that helps to contract blood from the superficial vessel, which is the venous system, superficial vein, which is the great saphenous vein and other perforating vein, from here to the deep vein, from the deep vein back to the heart. So by doing this now, what does it do? As blood is being pumped, are you getting now, from one part of the vein to the next, what happens? The valve, that's why I say venous system have valve, because when blood is moving up based on gravity, the valve below, which is the muscle, has to contract to prevent the blood from going back to the lower part. Are you getting now? So let me take, for instance, if blood is moving upwards to the muscles, that's why veins have a collapsible lumen. They have a collapsible lumen because they pass through muscles, and every time muscle contract a lot, and as muscle is contracting a lot, what happens? It compresses the vein, making their lumen so compressed. You get it now? So when blood is moving through the vein, through the muscular system, what happens? When it moves up, the muscle below it contracts. It is contracting so that the blood will not go back, will not retrograde back to the extremities. Are you getting me now? So by doing that, the muscle is trying to create an increase in venous pressure. So the venous pressure is increasing so that blood can move back to the heart. You get it now? So when the blood go up, the muscle distal to the vein contract so that the blood will not go back. So when the person move again, so when you continue moving or continue creating contraction of your lower limb, what happens? Or your muscles, what happens? It will be moving up and up and up in a one-way system. That's why the venous system have valve, because they create a one-way system whereby blood can go in one way and not retrograde back. Are you getting me now? So but if there's decrease in venous pressure, even though when you push it, the blood will not go, it will come down, which will cause what? Edema. You get it now? So that is one thing you have to know. So the muscle acts as a valvular system that helps to prevent retrogradement of blood back to the extremities by pushing the blood back into the heart. So a blood goes from the superficial veins to the deep veins, from the deep veins back into the heart. Are you getting that? And to take it from the superficial vein to the deep vein, it has to increase what? Muscle contraction. Are you getting me? And the muscle acts as valve, and that valve helps to push blood up. Remember, so you have a proximal valve and you have a distal valve. So when you contract, are you getting me now? If you are contracting, the distal valve will open to push the blood up to the proximal valve. So as the blood moves towards the proximal valve, the distal valve will close. Are you getting me now? Opening the proximal valve for the blood to leave the proximal valve. That's how it works. So blood enters the distal valve. When it passes to the distal valve, which is the muscle creating their valvular system, it holds again. the proximal valve will open again. So when you contract the muscle again, the blood will move through the proximal valve and be going until it reaches into the right atrium. So that's how muscle pump can create an increased venous return. So with the first one, we talked about respiratory pump, how inspiration can increase venous return. The second one, we talked about how muscle pump can increase venous return. So the next one we want to talk about is gravity. So what is gravity? Remember, gravity pulls everything in the earth to the lower side. Are you getting me now? So when you stand, what happens to all your blood? Are you getting me now? Due to capillary system, your blood moves downwards. Are you getting me? Because gravity pushes them downwards. So standing in an upright position, which means your cardiac output is usually influenced where you are standing above than when you are sitting or when you are lying. You get it now? So the cardiac output is different because it will fluctuate when you are standing, because all your blood component and fluid is going downward to your extremities. So gravity pulls them down, causes what we call venous pulling. So venous pulling occurs when all the blood, instead of going up, are pulling downwards. But what happens? That's why you don't stand for a long time. You try to move, so that as you are moving, what happens? Your muscle will be contracting the blood, pushing the blood upwards, because you need a strong capillary system to push that blood upwards. If not, the blood will go down and maybe there will be edema. After edema, there will be a clot formation, which might dislodge, causing thrombosis and traveling to tiny vessels like your brain, and which can cause stroke or other effects. So what happens? So gravity decreases venous return, muscle pump increases venous return, respiratory pump increases venous return. Why does gravity decrease venous return? Because when you stand, all the blood goes to your extremities, which means so many organs are lacking blood at that particular point in time, because no pressure is the pressure needed to push them is very, very high. So gravity is inversely proportional to the cardiac output. So the next one is venous pressure. Are you getting now? So the venous pressure to increase cardiac output, your venous pressure has to be what? High. But there are different venous pressure for different parts. Are you getting now? So the venous pressure also affects the what? Venous return. So when you increase venous pressure, you increase venous return. Why? Because when you respire, when the IVC is compressed to push blood upwards, what have you done? For you to contract the what inferior vena cava, what happens? You have increased the venous pressure. When the muscles is moving, contracting blood from superficial to deep vein, what happens? You are increasing venous pressure. So what happens? So venous pressure is different. Venous pressure in the veno is different. What is the veno? The veno is the terminal part of the what? Capillaries. Are you getting that? The terminal part of the capillaries that lead into the vein is called the veno, and their venous pressure there is 12 to 18 mmHg. Are you getting that? So in smaller and larger vein, the pressure gradually decreases. Are you getting that? From the smaller to the larger vein, the pressure decreases. So there is much more pressure in the vena than in the what vena cavas. The vein you have the largest what pressure, and the pressure is about 12 to what 18 mmHg. But in great vessels like the inferior vena cava, it has reduced to about 5.5 mmHg, which means for you to increase venous pressure, you have to create a very high amount of what force in order to increase the venous pressure. Because when you increase venous pressure, you increase venous return, and when you increase venous return, you increase cardiac output. So the pressure in the venue is higher. Are you getting me now? But it decreases as you go upwards. Why? Because gravity tends to counteract the pressure. So to now counteract it, you have to move. So if you don't move, what happens? After a long period of time, you see that your brain is no more receiving oxygen, and the next thing you see, you have syncope. Are you getting me now? So very, very important. So the venous pressure is directly proportional to the venous return, which is directly proportional to the cardiac output. So which means, let's also say that the cardiac output is directly proportional to the venous pressure. Are you getting me now? But inversely proportional to gravity, because when gravity decreases cardiac output. Are you getting me? And gravity also decreases venous pressure. Gravity decreases venous return. Are you getting me now? So the only people that support cardiac output is one, respiratory pump, increase in inspiration, increase in cardiac output. The next person is muscle pump. When you contract the muscle, are you getting the valve closed to prevent retrograding, sending the blood upwards, increasing venous return. Gravity decreases venous return, also decreases cardiac output. Venous pressure increases venous return. So the higher the venous pressure, the higher the venous return, the higher the cardiac output. Sympathetic tone. So how does sympathetic tone affect venous return? So the veins are blood vessels. Are you getting me now? In the presence of fight or flight or any stressful condition, your body increases what? Norepinephrine. So norepinephrine binds to what we call the alpha 1 receptor on the vein. So when it binds to the alpha 1 receptor, it increases the venous pressure by reducing the size of the vessel. So when it reduces the size of the vessel, what happens? The venous pressure will increase, and as the venous pressure is increasing, the venous return will increase. Are you getting me? So sympathetic stimulation releases norepi due to stress. I get him now. So when it occurs during stress or fight or flight, what happens? Norepinephrine will be released, bind to the alpha receptor on the blood vessel. Then what will happen? There'll be increase in venous pressure, and when there's increase in venous pressure, there's increase in venous return. Are you getting now? So another thing you have to know again, that there are other stuff that also affect venous return. Posture. So we talked about it already. Being in a standing position draws blood towards your what? Extremities. Are you getting me now? It drops blood to your extremities. So that's why there's what we call orthostatic hypotension. Orthostatic hypotension is changing in position, maybe from lying to standing or from lying to sitting. So when you change your position from lying to sitting, what happens? Your venous return will drop, and as your venous return will drop, your venous pressure will drop, which is your blood pressure will drop. So during change in position, you have hypotension, and hypotension is due to a decrease in venous pressure, causing a decrease in venous return. So in standing position, your venous return drops, same as your venous pressure. So your venous pressure has to drop, then your venous return will drop. So in changing position, posture is one important thing. So posture can cause what we call orthostatic hypotension, drop in what? Drop in your blood pressure while you change position, and due to the fact that the brain is not seeing enough oxygen. So if the brain is not seeing enough oxygen, you get to start feeling dizzy. That's why you faint. Are you getting me now? So the next one is environmental temperature. So how does environmental temperature affect? Moderate change in temperature do not really affect venous return, unless when you start having increase in temperature. So during maybe in the afternoon when there's sun, that can greatly affect the venous pressure. Are you getting now? And affecting the venous pressure affects the venous return. Now remember, temperature, when you have an increase in temperature, it causes the release of what? The parasympathetic activities are usually being stimulated, which causes vasodilation of the blood vessel. So high temperature vasodilate the blood vessel because heat is distributed throughout the vessel, but that can also increase venous return. So increase in temperature can cause vasodilation of the blood vessel, which can also increase venous return. So change in position now. Posture. Standing posture decreases venous return. Sitting posture can also help, but there are good positions, good cardiac positions that could help increase your venous return, like staying in a cardiac line, whereby you put the backrest of the seat in 30-degree line. That can increase your venous return. At least trying to elevate the leg a little, because elevate the leg helps your blood to drain back into the heart. Are you getting it now? So temperature increases venous return. A very high but moderate temperature do not affect venous return. Emotional condition like anxiety, apprehension, excitement increases venous return. Why? Because when you have anxiety, I said before, during stress or any fight or flight activity like crying, tears, running away from something, increases what we call norepinephrine. And when you increase norepinephrine and you increase epi, so epi stimulates the contraction of the heart, while norepinephrine stimulates to increase peripheral resistance in the blood vessel. So epinephrine is being released, bind to the receptor in the heart, contract the heart, increases cardiac output also. Why? For the venous return, what happens? Now epinephrine bind to alpha 1 receptor, contracting, increasing venous pressure, increasing venous return. Also pregnancy. So how does pregnancy? So pregnancy also helps to increase venous return. Why? Because there'll be so many things that will be occurring during that pregnancy, because during the last stage of pregnancy the venous return increases. Why? Because you need to supply blood to the baby. So the baby needs blood, and so you have to give the baby blood by increasing the venous return. So we have talked about the venous return. So the next one we'll be talking about is the force of what? Contraction. So how does force of contraction affect here? So naturally, force of contraction is the force needed to contract the heart. Are you getting it now? The force needed to contract the heart, because if the heart is not contracting, which means the heart is not pumping blood, and if the heart is not pumping blood, that means the tissues are not seeing blood. So which means the heart has to contract for the tissues to see blood, which means the force of contraction is directly proportional to the cardiac output, same as the venous return. So when you increase the contraction of the heart, so venous return is usually in the veins, but the force of contraction is talking more about the heart. So you need epinephrine here. Adrenaline or epinephrine is needed for contraction of the heart, really. Because in my cardiac cycle, I taught you that the SA node releases action potential to the AV node, which spreads it to the bundle of his right and left bundle branch for the contracting fibers to contract. In doing this, you need epinephrine to be expressed here by binding to the receptor in the SA node and causing contraction of the contractile tissues, which is the atrium and the ventricle. Are you getting now? So remember, force of contraction is directly proportional to the cardiac output. So based on Feinstein's principle, what does it say? Force of contraction of the heart is directly proportional to the initial length of the muscle fiber before the onset of what? Contraction. So Feinstein's principle here is talking about isometrical contraction, which means when you increase the front of contraction, what happens? You are increasing the initial length of the muscle fiber before the onset of what? Contraction. Are you getting now? So when you increase the force of contraction, you increase the cardiac output. So the force of contraction, for you to have an effective force of contraction, you have to have a preload and an afterload. So put your ear very well to this, because you'll be asked the preload and the afterload. Very, very important. The preload and the afterload. So what happens here? In the preload here now, why do we call them the preload? The preload is very, very important phenomenon here. The preload is the stretching of the cardiac muscle at the end of that. So remember, blood is being pumped from the atrium to the ventricle. Are you getting me now? Doing ventricular what? Diastole and a small part of atrial systole. So doing ventricular diastole and a small part of atrial systole, blood is being pumped from the atrium to the ventricle. Are you getting me now? And here, to have a preload, which means you have to have, remember, the atrial pressure is not that big because gravity helps blood to drain from the atrium to the ventricle. Are you getting me now? So the ventricular pressure, why? Are you getting me now? Why the blood is dropping from the atrium to the ventricle? As it is stretching the ventricular wall, as it is stretching is what happens. The ventricular pressure is increasing gradually. Are you getting me now? The ventricular pressure is increasing gradually, getting ready to contract and release it to the aortas. Are you getting me now? Now, always remember, what is preload? The preload is the amount of blood dropping into the ventricle, stretching the ventricular muscle fibers. So when it's stretching the ventricular muscle fibers, the length of the muscle fiber is increasing isometrically, getting ready for contraction to be released into the pulmonary trunk and the what? Aorta. Are you getting me now? So doing atrial systole and ventricular diastole. So the ventricular diastole is a period whereby the ventricle is receiving blood and it's relaxing, and in doing this now, he wants to collect the total amount of blood dropping into the ventricle, which is the end diastolic volume. So the end diastolic volume is the last amount of blood that enters into the ventricle during ventricular filling. Again, the preload is the event whereby the blood enters into the ventricle during ventricular filling, and the end diastolic volume is accounted for in that, which is about 150 ml. So when the end diastolic volume is accounted for, the muscle wall has stretched to the point that it has increased its pressure, and usually was the pressure about 120 mmHg. So when the pressure is that enlarged, it will now increases the force to pump it through the pulmonary trunk and through the aorta. Are you getting me? Because you need a good preload to take the blood from the ventricle out, because you have to take it up. It is not down. If it's down, like atrium to ventricle, gravity can help you. You need a more lesser pressure to push blood down, but you need a greater pressure to pull blood up. So preload is the amount of blood that drops into the ventricle, stretching out the ventricular muscle fiber isometrically. Why did I say isometrically? Because it will still come back to the same shape after it has pumped blood away. Are you getting me now? Because if it goes higher too much, you have what you call ventricular dilatation, and which is a problem. So when blood enters into the ventricle will stretch, collect the blood and pump it away. So that's preload. Are you getting me now? Because as it is increasing isometrically, collecting blood, the more the blood is touching, the more the pressure is increasing needed to push it out. Why in afterload? What happened in afterload? Remember, the pressure is higher in the aorta and the pulmonary trunk more than in the ventricle. Remember, because remember, it takes more power to push something up than to push something down. So now, during filling phase, what happens? The aorta and the pulmonary trunk has much more pressure than the ventricle. But doing ventricular systole, that is the first one, is doing ventricular diastole. Doing ventricular diastole, when the ventricle is receiving blood, the aorta and the pulmonary trunk has much more pressure. There's much more pressure there because they are in what we call protodiastolic period, so they have much more pressure there than the ventricle. But after the ventricle have received all the whole blood and stretch over a considerable limit, what happens? The pressure gets high, and automatically the ventricular pressure becomes higher than the aortic and the pulmonary pressure. That's afterload. That's what afterload. I get it now. So preload is the loading force. I get him now. That is given by the blood that is dropping on the what ventricle. So the amount, as the blood is increasing in the ventricle is stretching. I get him now. As it's stretching, it is preparing for a big burst of blood vessel going upwards. So the preload is when blood enters into the ventricle, and the afterload is the amount of blood that is released from the ventricle. First of all, doing ventricular diastole, as blood is entering from the atrium to the ventricle using gravity assisted, what happens? The aortic and pulmonary pressure is high, but when the blood enters, 150 ml endosolic volume enters, it will push blood with a greater force, and that pressure will now be higher than the aortic and pulmonary pressure. And the problem here is that if the pressure of the aorta or the pulmonary trunk is higher than the ventricle, regurgitation of blood will occur, which means the blood will not be able to move from the ventricle to the aorta. Anything that makes the aortic pressure and the pulmonary pressure to be high, which means the ejection fraction will be low, which means all the whole blood will be clogged up into the ventricle, causing what we call ventricular dilatation, and you'll be hearing murmur. Are you getting me now? So afterload is when the ventricular pressure is greater than the aortic and pulmonary pressure, while preload is the amount of blood that enters into the ventricle, causing it to stretch and prepare to release the blood. Are you getting me now? Are you getting me now? So always remember that the force of contraction is inversely proportional to the afterload. Don't forget, the force of contraction is inversely proportional to the afterload, because what happens? You need much more pressure to push all the blood from the ventricle out of the aorta, which means the ventricular pressure must be greater than the what? Aortic and pulmonary pressure. You get it now? So now another one is heart rate. So we have talked about the force of contraction based on Frank Stanley's principle, which is directly proportional to the cardiac output. So heart rate occurs when the SA node fires action potential and spread it to the rest of the conducting fibers down to the ventricular fibers. That's where you get the heart rate. Are you getting it now? So when the SA nodes send out information to the AV node bundle of his into the ventricles for contraction to occur, you will receive your heart rate like that. That's how you know the rate and rhythm of the heart. But one thing you have to know, that moderate changes in the heart rate does not alter the cardiac output. I get him now. Moderate changes in the heart rate do not alter the cardiac output. But when there's an increase in heart rate, cardiac output increases. So increase in heart rate increases stroke volume, increases cardiac output. So when you increase the firing of the conducting fibers to the contractile fibers, what will happen? There will be increase in heart rate, increase in stroke volume, and increase in cardiac output. Are you getting now? So when there's a decrease in heart rate, there will be decrease in cardiac output. But when there is a considerable increase in heart rate, like in tachycardia or any cardiac arrhythmia, like supraventricular tachycardia or normal tachycardia or ventricular fibrillation, anything that damages the heart rate, what happens? The cardiac output will reduce. But naturally, when the heart rate increases, stroke volume increase, cardiac output increases. Are you getting that? So heart rate increases cardiac output, but decrease in heart rate decreases cardiac output. Ventricular resistance. So remember, ventricular resistance is the resistance offered by a blood vessel. Are you getting that? So the resistance that offers in a blood vessel preventing blood from flowing is called peripheral resistance. And when we talk about peripheral resistance, we are talking about the vessels distal, in our distal part, not in the heart. In the distal part, like in the fingers or in the toes or in the lower limb. So these are peripheral vessels. In the atrials, arteries, all those distant vessels that are not closer to the heart, these are peripheral vessels. And when you have decrease in the diameter of peripheral vessel, what happens? There will be decrease in cardiac output. So peripheral resistance is inversely proportional to cardiac output, but directly proportional to the heart rate. So but directly proportional to the blood pressure. So when you decrease peripheral resistance, the pressure needed to push blood through that vessel will be high. Take for instance, you have a pipe that is big and you decrease the size of the pipe or decrease the diameter of the pipe, what happens? The rate at which water is moving there naturally, if the pipe is removing 5 liters and you decrease the size of the pipe, what happens? This volume in which the pipe will be releasing every minute to more normal way 5 liters, it will decrease. I get it now. So therefore cardiac output will reduce. But do you know what will happen? It favors blood pressure, because you now need pressure will not be occurring in the pipe, because the substance that is supposed to pass through the pipe will now be high. That is why peripheral resistance is directly proportional to the blood pressure, but inversely proportional to the cardiac output. Why? Because less amount of blood can now pass through that vessel. So less resistance, more cardiac output. High resistance, less cardiac output. But it favors blood pressure. Are you getting now? So one thing you have to understand now, we have variation of what cardiac output. So what are the variation of cardiac output? So we have physiological variation and pathological variation. Don't forget, physiological variation and pathological variation. Now physiological variation, like age, what happens? So who is the cardiac output much more higher, who is much more lower? So it is much more lower in your children. Are you getting now? It's much more lower in children but gets higher with age. So cardiac output increases with what? Age. Don't forget. Now the next one is sex, boys and girls. So it is much more lower in female but higher in male. Why? Because the male has much more anatomical musculature or anatomical structure that needs more blood. Not that it's more than the female. Female too also have structures that need more blood, but in male there are much more complex structures that need blood. And also due to the menstrual cycle, females still lose blood, so that decreases their cardiac output. So male has more blood, slightly more than the female. Body build, are you getting that? So large body size have high cardiac output. For those that are gymming, those that are going to exercise, those that are doing most complex stuff, they need more cardiac output than those that are not doing anything. Why? Because their blood must be circulated to their tissues, because they are undergoing stress all the time, or their body size is very big. Are you getting that? And remember I said cardiac index equals to cardiac output over body surface area. So when you increase the body surface area, the cardiac output has to what? Increase. Duodenal variation, what happens? Cardiac output is slightly lower in the morning. Why? Because the pressure is low, the temperature is low. It's slightly in the morning. Are you getting now? So in the afternoon, when there's high temperature, I told you there will be vasodilation of the blood vessel, and when there's vasodilation of the blood vessel, there will be increase in cardiac output. So cardiac output is high more in the afternoon but lower in the morning time. Temperature, what happens? I still say it, increase in temperature, increase in cardiac output, because there will be vasodilation of the blood vessel due to heat distribution, increase in metabolite in the blood, then the increase in cardiac output. Are you getting that? So temperature increases cardiac output. Very well. Emotions, remember, emotions increase cardiac output. Why? Because there will be release of cortisol and catecholamines. So catecholamines, which include what? Dopamine, epinephrine or epi. So noepi will go to and bind to a receptor in the heart, while epinephrine will go to bind to a receptor in the heart, while noepi will bind to the receptor on the blood vessel. So the goal is to increase cardiac output. After meal, so when you just eat finish, what happens? There are more metabolites in your blood, because there will be absorption of food. All nutrients will go into your blood, and if they go into your blood, automatically they will increase heat. Are you getting now? They will increase heat. That's when your thyroid gland will release thyroxine, causing vasodilation of the blood vessel. So when there's vasodilation of the blood vessel, what happens? There will be increase in cardiac output. Why? Because those nutrients has to be supplied to various tissues, and as they supply to various tissues, you need to open up the vessel to allow them to be supplied. So that is why I said after meal increases cardiac output. Exercise also increase cardiac output, because during exercise, what happens? You also releases what we call cortisol, healthy cortisol, not bad cortisol. You also releases endorphin, so many useful hormones that helps you cope through the stress. Okay, and when you release all these hormones, what do they do to your blood, your blood vessel? They help increase your cardiac output. They increase venous return. From increasing venous return, they increase cardiac output. And also during the exercise, you are moving your limbs very well. Anytime you do exercise or move your limbs too much, what happens? You are draining blood from the superficial vein to the deep vein, from the deep vein increasing cardiac output to the heart. So the next one is high altitude. What happens? So when you go to high altitude, what happens? You are increasing your cardiac output, because what happens? At high altitude, what happens? The oxygen level drops. And if the oxygen level drops, what happens? There's no oxygen, you'll be hypotensive. So when you're hypotensive, what happens? Now your body start producing enough of a red blood cell at high altitude to erythropoietin. So when your body start producing a lot of red blood cell to erythropoietin, so there'll be too much red blood cell in the blood, vasodilating the blood vessel. Now, due to a reduced amount of oxygen, fluid from your tissues will start going into your blood. And if they are going into your blood, there will be vasodilation of the blood vessel, increasing cardiac. So which means high altitude, what happens? Oxygen level drops, CO2 level increases, and the body become acidotic. And if the body become acidotic, immediately there will be fluid capillary shift mechanism that will occur, shifting fluid into the tissues. There will also be increase in red blood cell formation due to erythropoietin, which will vaporize all the blood vessel. There will be too much of red blood cell there. Why? Because you need oxygen. As the red blood cell increases inside the blood, same as the volume of the blood begins to increase. I get it now. And as it is increasing, what happens? You are increasing cardiac output. So pregnancy, what I tell you, so pregnancy increases the cardiac output. Why? Because there's increase in blood volume. So there's increase in blood volume in pregnancy, and when there's increase in blood volume, there's increase in cardiac output. Now, in pathological variation, what are the conditions that increases cardiac output? So we have fever. So naturally, I tell you that anything that causes heat, fever, when there's pathogenic attack on inflammation into the tissues, what happens? There will be vasodilation of the blood vessel. Vasodilation of the blood vessel will cause what? Increase in what? Cardiac output. So pathological increase in cardiac output is caused by fever, anemia, and what? Hyperthyroidism. So hyperthyroidism increases what? Cardiac output alongside fever and anemia. So pathologically, the conditions that can decrease cardiac output are what? Hypothyroidism, when there's a reduction in what? Tyrosine release. 2, you have atrial fibrillation, which is a cardiac arrhythmias. I get it now. When there's a loss of P wave, so you go to my ECG playlist, you see it. When there's a loss of P wave, which means the atrium is not contracting at all. So atrium is not contracting, not being able to push blood. Why? Because the SA node is not releasing action potential. It is not the AV node or the bundle of heat that is releasing. Incomplete heart block too. When there is incomplete heart block in the AV node, there will be difficulty in cardiac output, because the atrium is not really pumping blood to drop into the ventricle. So when there's decrease in the shifting of blood from the atrium to the ventricle, what happens? There's decrease in cardiac output. Congestive heart failure. So in congestive cardiac failure or heart failure is when the heart is not being able to pump blood very well to the tissue due to a lot of accumulation of fluid. I get him now. So there'll be so many conditions, and this, in congestive heart failure, the heart is not really beating well, and that also affects the cardiac output. Hemorrhage too. So during hemorrhage, what happens? During hemorrhage, automatically your blood has been lost, and when your blood is lost, what happens? The cardiac output have reduced. So your body is trying to manage that small amount of blood in your body. In doing that, it's conserving you until help comes. So I hope it all made sense to you and you have understood everything I've talked about in cardiac output. So in quick recap, we said that the cardiac output is the amount of blood that is pumped out from the ventricle every minute. Are you getting me now? Which is cardiac output equals to stroke volume times heart rate. Are you getting me now? And I said the cardiac output equals to the minute volume. And the stroke volume is the amount of blood pumped out from the heart in each heartbeat. Are you getting now? Which is about 60 to 80, which is 70 mil, which you talked about. While the cardiac output is about 5 mil per minute. Are you getting now? While the cardiac index is the amount of cardiac output per unit body surface area. And we talked about the factors affecting cardiac output. We say venous return. Increase in venous return increases cardiac output, which is dependent on the respiration, dependent on the muscle pump, sympathetic tone, venous pressure, and gravity. They all are very important in increasing venous return. Force of contraction too. The amount of contraction, the initial fiber of the cardiac muscle contract in order to push blood. So it's dependent on preload and afterload. Heart rate. When you increase heart rate, what happens? You increase cardiac output, because the heart rate is directly proportional to the cardiac output. Peripheral resistance is inversely proportional to the cardiac output. Why? Because when you decrease the size of a vessel, you have decreased the amount of blood that is passing through that vessel. Okay, that's so it's inversely proportional. So hope you have understood everything. Hope you stayed with me to this journey until now. So I explained what cardiac output is 100% here for you to understand. Are you getting now? So if you are just joining me for the first time, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. So if you don't understand or there's something you don't understand very well, drop it down in the comment section. If you want to ask any question, also drop it down in the comment section. I promise I will make that video for you when I come. So I'll be seeing you in my next video on blood pressure. Bye bye.